So what is going on right now? I'm sure you're all aware. It does sound like you're very much aware that telehealth policy and telehealth changes to that policy and telehealth itself has just really taken off during COVID-19. It was sort of a bit of a niche field before COVID. I mean, it was around and it had been around for a while, but it hadn't really gained like the prominence that it's had now during this pandemic. I mean, just to let you know, I've been doing telehealth policy for about 10 years. And before COVID, I still had family members and friends who were very confused as to what I did for a living. But now with COVID, they're like, oh, yeah, telehealth. Yeah, no, I get that. You must be really busy right now. But with all that, because it was such a niche field, there was a rush to like make a lot of telehealth policy changes, at least on a temporary basis. So the question now becomes is, well, what happens when the public health emergency is over? You have a lot of these changes that are temporary in place. People are worried there's going to be a cliff effect if the public health emergency is declared over and you abruptly just go back to that pre-COVID landscape where telehealth is concerned. It's like all these people made all these investments. All these patients have now been receiving services via telehealth and used to it. Suddenly you cut them off and say like, nope, you got to go back to your old ways. It's going to have like, pretty sort of dramatic effects on, different providers, different patients. And policymakers are very much aware of that. So they're wondering like, how do we like soften it or gradually transition, or do we not even transition and maybe make some of this permanent?